Aziza, how are you?
I am very well. I'm really excited and honored to be here. As you know, I am one of your biggest fans.
Oh no, I'm one of your biggest fans, literally. And thank you so much for joining. Hello, everyone. I'm Tineke, one of the co-founders of Five Times More, and today we are with the amazing. I have no words. Like I'm so excited for this chat. Amazing Dr. Aziza Sesay, GP and women's health advocate and extraordinary woman. But
Uh,
I'm not going to introduce her. She's going to introduce herself and just tell you all the things. Go for
thank you so much. That means a lot, honestly. I mean, I should introduce you, but I'm
it.
I'm Dr. Aziza Sesay. I'm a GP. I'm a GP educator. I'm also an honorary senior clinical lecturer. I'm a
Come
host,
on.
a speaker. Platform, Talk to Dr. Sesay, which is all about health, education, advocacy, and awareness. I'm also carrying around, and I brought it with me. I also carry around this bad boy. What is this, Tineke?
Oh, don't test me.
You should know. What is this?
This is your vulva.
Thank you. Well
I've
done.
been
Yes.
around you enough times to know if I got that wrong, I think you'll actually be upset because
I'll be coming to your house. Yes, it's a vulva. And I carry it around, not just because it's cute and funny, but also because I'm trying to destigmatize everything to do with women's health because there's a lot of stigma, shame, embarrassment, taboo that's associated. And often people are suffering in silence because of that embarrassment. And there's also a lot of censorship. And I don't want to take too long on this call talking about that because it's so frustrating trying to get the information out there to improve the gender health gap, which is so bad. It's also brown or black or similar to my skin tone, again, on purpose, because how often do you see that representation, right? If you don't see it, you can't be it, you can't relate to it, and also you don't think that it pertains to you. So, yes, I am someone who is very, very passionate about representation. I'm passionate about health and equity, women's health, gynecological health, mental health, and cancer awareness.
amazing. See, you see why she's just extraordinary with your brown vulva.
Yes, my little purse.
And literally, that thing is your handbag at this point. You should get a handbag made of that at this point because there's no point in time where I ever see you without it. It is. But yeah, no, thank you so much for joining us today. I think the topic is a very interesting one. I can't wait to hear more about it, because it's one that I think I know a lot about, but not within the context of pregnancy. So let's do it. Today's topic is about endometriosis. I'm just gonna go ahead straight in with the first question. What is endometriosis?
Very important, right? Because we're not going to assume that everybody knows what endometriosis is, but everybody should know what endometriosis is. So I did bring my other bad boy, which is this, the internal gynecological anatomy model, because it's so much easier to explain things when you can visualize where things are. So you have the ovaries on either side, you have the fallopian tube. So the ovaries is what releases the egg every single month, okay? So the egg is released, it goes through the fimbriae, so these are like little tentacle things that catch the egg. They're not attached to the ovaries, just so you know. So they catch the egg, and then it goes into the fallopian tube, down into the womb, yeah. And if fertilization and implantation happens, it implants onto this area. So this is what we call the endometrial lining. I'm going to talk about that again in a second. Then we have the cervix and then the vagina, which is on the inside. The vulva is on the outside, right? So that's what happens. Every single month, this endometrial lining that I'm pointing at, it thickens because of the hormonal changes. And then when the hormone levels drop, if pregnancy doesn't happen, then it is this lining that sheds and comes out as a period. So another important point, period blood is just that. It's just the endometrial lining shedding. It's also maybe a little bit of cervical mucus and some vaginal fluids, but that is it. It's not that we're removing any toxins. We're literally just bleeding or shedding our endometrial lining. Now, the reason I talk about endometrial lining in the context of endometriosis is where you have endometrial-like tissue, so similar to the lining, found in places outside of the womb. So you find it either in the ovaries, the fallopian tube, it could be on the vagina, but also the structures that surround the womb. So in front of the womb we have bladder, So you can get endometrial tissue on the bladder, and it can cause symptoms associated with that. Or behind the womb is our bowel and the rectum. So you can get endometrial tissue there as well. You can get endometrial tissue around the walls of the abdomen itself, but it can also travel as far as the lungs in some people. There's
Yeah.
also cases of it in the brain. So that is basically endometriosis, having endometrial-like tissue in places outside of the womb. And unfortunately, it causes multiple symptoms due to it being in all these other places. So that includes having very, very painful periods. So often people associate endometriosis as painful periods, but it is that, but not just that. It's also if you're getting rectal pain because of the endometrial tissue being there, bleeding from your back passage. You can even have blood in your urine. You can have pain, like severe abdominal pain. Some people cough up blood because of the endometrial tissue in their lungs. It can affect fertility, and that's because, remember I said that the egg travels up this way and into the fallopian tube down that way. If you have endometrial tissue on the fallopian tubes, it can then cause a blockage because there's nowhere for it to go. And so the egg won't meet the sperm, fertilization won't happen. Endometriosis is known as an inflammatory conditions. It causes inflammation in the different aspects and scarring of tissues. And it's important to remember that endometriosis, the tissues act in the exact same way in response to the hormones as it does in the womb. So when you get the thickening happen, it also happens in these outer places. And because there's nowhere for it to grow, it causes that irritation and the pain that's experienced because of the tissue thickening. And then there's nowhere for the lining that sheds to come out. So we know in the womb it comes out here. Whereas when it's in these other places, there's nowhere for it to go. So it then causes more inflammation, irritation, and then it causes scarring. And it's such a painful, severely debilitating condition for so many women and anyone assigned female at birth. Another interesting thing to say before I stop talking, sorry, I've said so much.
Oh, no.
Is that men can also, there have been cases where endometrial tissue has been found in men, and particularly those who are having hormonal estrogen treatment for instance, when they're treating their prostate cancer. So they have found it in men as well. So there's still not much understanding as to why it happens and what the process is, because unfortunately, when we talk about women's health and the research and the lack thereof of it, what they say 1% to 2% of research is in women's health if we remove cancer. So it's a lot.
Wow. Okay. I don't even know where to begin because you've said so many things that I was like, oh my God, I did not even know that. I didn't know you could find it in your lungs, in your brain. Didn't know men could get it. And it also makes sense, the fact that it's supposed to happen within that lining that you said and shed. But if there's nowhere for it to go, of course it's going to become inflamed and cause pain all over your body. And that makes so much sense. Wow. Wow. Okay. I feel like I've just been schooled. Hopefully anyone out there who thought they knew, because I thought I knew endo, but you have just broken that down in such a very simple way. And yeah, wow. Okay. Very, very interesting. So I guess you've already covered it, but who can have endo? I didn't know men could. I'm still shocked at that. Who can have endo?
So yeah, anybody assigned female at birth, anybody with a womb who has the tissues, but also, like I say, in very, very rare cases, men also have it. And it commonly happens in women of reproductive age. So from menarche, from when they first having periods to menopause, right? And the common age that tends to be diagnosed is between the ages of 30 to 40. But actually, we've seen a lot of cases of very young teenagers having symptoms and being diagnosed. Now, I think part of the reason that people are diagnosed, or it's more commonly associated in that age range, is because it takes almost 9 years in the UK 8 years and 10 months, I believe. It used to be 8 years. Now it's 8 years and 10 months. It's just getting worse. It takes so long to diagnose endometriosis. So I believe that perhaps actually there are probably it is quite common in younger age groups. It's just that they're not being diagnosed. And part of the problem as well is because unfortunately women's pain is often dismissed. We're not listened to, and it's always um, what's the word? Underestimated. So there's that. But the other thing to say is anyone who also has hormonal imbalances, they could also have high risks of developing endometriosis. So endometriosis is known as an estrogen dependent condition. So any hormonal imbalances that cause the estrogen levels to increase will increase the risk of the individual developing endometriosis. So obesity, unfortunately, that increases the levels, PCOS, hyperthyroidism, liver diseases, all of those can increase the estrogen levels, which then increases the risk of endometriosis. But also it's common in individuals who have a family history. So until now, we don't quite understand, like I say, the why it happens, but the associations in individuals who have a family history, that increases the risk. Also, someone who's never had any children, again, that increases the risk. And then there's the ethnicity thing. So when we look at the study and the data that's out there, it's strongly associated with white Caucasian women. And also there are higher rates in South Asian women.
Okay.
However, the fact of the matter is, it probably is also highly prevalent in Black women. But the reality is, one, there's the health literacy. Not many people are aware of endometriosis at all, and also aware of the symptoms associated with endometriosis, particularly within our community. Also within our communities, we are more likely to have conditions like fibroids, right? So fibroids can cause symptoms like painful periods, it can cause increased urination. It causes symptoms that can be quite similar to endometriosis. Now, Black women are 2 to 3 times more likely to develop fibroids. And if they are having symptoms, they will often put it down to fibroids, right?
I've never thought of that. I just, sorry, I don't even want to cut you midway through your flow, but my God, that makes so much sense. That makes so much sense as to, well, it's more common in Black women. It's probably just fibroids. That makes sense, rather than it being, oh, this might be something else, because it's seen as a condition that is mainly a white condition, because, they're not prone to fibroids or any other thing that it could be. So it's, for white women it's endo, for Black women it's probably fibroids.
Yeah.
Actually, it could be a lot more than that, but we're not afforded that opportunity.
Yeah.
Oh my gosh, mind blown.
Within ourselves, but also within healthcare. So we, as individuals, may think, well, my symptoms probably due to my fibroids, but also the healthcare professional that you see will probably put it down to that. But also the realities that exist within Black women. We say women in general don't feel listened to or dismissed. It's even worse, unfortunately, within our cases. Yeah. So again, it's that dismissal and not being seen and not being taken seriously, which then adds to the delay and may contribute to why the rates aren't as high in Black women, when really it might be.
So I was doing some research, because I was doing some I was writing not on this topic, but I was writing on something else, and I saw something along the lines of, we get the same rates, like you said, we actually do have the same rates, but it's just diagnosed a lot later. Like, I know you said the diagnosis is like, it takes forever, but for Black women it's even more, again, probably for these very same reasons. So it's not that we're not getting it as much, we are, but we're just not being listened to, or it's maybe putting down to something else, or so many other different factors there. So that's very, very interesting.
Or not coming forward as well. I think that strong Black woman narrative as well doesn't help. So we need to prioritize ourselves and put ourselves first, because that definitely contributes to the current statistics. But we'll see. I mean, things are improving.
Yeah, Yeah, definitely. I mean, you've obviously answered my next question, which is great. Is there a certain community that's more prone to endo? So we've listed all the different kind of like communities and that, but like, would you say it's the same across the board? Doesn't matter what your ethnicity is, or are there any? Is there anyone that's a bit more prone to it?
Honestly, like I say, at the moment, what is out there is that endometriosis more commonly affects white women and South Asian women more at the moment. But like I say, everything depends on the diagnostics, the access, the health awareness, you
Yeah.
know, and then just the overall treatment. So we don't have a definitive, we can't, I don't think that it's fair to say 100% yes, it affects this group more. At present, what we have based on what's available, it
Mm,
affects white women and South Asians. They're more likely to have it. However, my understanding is the symptoms are often worse in Black women. The experience of the symptoms is often worse in Black women, and complications,
yeah.
unfortunately.
That's very unfortunate. Very, very unfortunate. So, in the context of endo and pregnancy, you've obviously explained how it can affect the lining and the eggs and, falling down and it being coming in contact with the sperm because it's inflamed. Can you get pregnant if you have endo?
Yes. So that's a really important question. And it's one that I feel is often riddled with a lot of misinformation. So
Mm,
people assume that you can't get pregnant if you have endometriosis. You
mm,
can, but it will be more challenging, unfortunately, if you have endometriosis. And I kind of mentioned some of the factors associated. Um, it can affect the egg quality, you know, it can affect ovulation. Again, if you have endometrial tissue or like tissue, sorry, on the ovaries, that can affect the development of the egg, the release of the egg. If it's on the fallopian tube, as I say, it can block it and then it can affect it reaching the womb. The changes that can happen, all the inflammation and the irritation surrounding the area can affect implantation. So the fertilized egg implanting onto the womb itself. All
oh,
of these factors affect pregnancy, getting pregnant in general, right?
yeah.
But as well as that, it can also affect pregnancy progression. So if you do get pregnant, unfortunately, you're at higher risk of having miscarriages. Again, because of, I guess, the egg quality and what's been fertilized. You know, if it wasn't the best, and there may be chromosomal problems that can lead to miscarriages happening. But again, just the overall structural changes, all of the inflammatory process, the immune response, all of that again can contribute to how the pregnancy proceeds, and again lead to complications, lead to miscarriages. So there's a lot when it comes to pregnancy and endometriosis.
Yeah, because the next question is obviously you can get pregnant, but does it
Yeah.
affect your pregnancy?
Yeah. So yeah, as I say, it can affect the pregnancy. It can lead to more complications occurring. They would often need to have specialist care when they are seeing when they are going through their pregnancy in general. So usually in an uncomplicated pregnancy.
That's if they know. Sorry, that's if they know they have it, right? Yeah.
Yeah. So true, so true. Because there's so many who think, oh, I've always had painful periods. It's just one of those things, right? And
Yeah.
in fact, actually, there are people who belatedly get diagnosed with having endometriosis because they have recurrent miscarriages. So
Right.
when they do the assessments,
Oh,
you know, they go through the history. Oh, you've had really painful periods for several years. Okay, let's do some investigations. They do the assessments. They eventually find, oh, you have endometriosis, and that is why.
whoa.
Yeah,
Another mind-blowing moment. My
yeah,
goodness.
yeah.
Yeah, we'll have to talk offline because my brain is going. My brain is going because
There's a lot.
I'd never think that. This is why it's great to have these kind of chats. I'd never put the two together. Someone having very, very painful periods and then having recurrent miscarriages, and actually all this time they had endo, and
Yeah,
this is whoa, I'm
yeah,
mind blown, honestly.
yeah.
That's that's actually a game changer. And I think there needs to be more discussion about this, because I'm obviously thinking in the context of what we know, the
Yeah.
stat, maternity, ethnicity, Black women
Yeah.
are prone to miscarriages. So could it be that actually maybe some of them, it might be due to them having endo that's not been
Yeah.
diagnosed, or these,
Yeah.
wow, I've never put the two together. That's
Yeah.
very, very
I think it's just one of those things, isn't it? And that's why I applaud you for putting this together and having all of us different healthcare clinicians with different specialist training to have this discussion. So it's out there for the public and everything that you're doing, because I think this is the biggest issue.
mm,
It's the lack of awareness within our community, the lack of health literacy.
yeah,
Like, and I always say this, you don't know what you don't know.
yeah,
You just now didn't know that you didn't actually know that much about endometriosis. You know what I mean? You thought that you knew as much as possible. I still don't know enough about endometriosis myself. I'm still learning. So
mm,
there's a lot out there that we need to educate ourselves about. And I feel like that could 100% improve people's suffering, because there's so many, as I say, who are suffering in silence. It can improve their symptoms. It can improve their overall outcomes, overall care, and it can actually get people to go forward. You know
yeah,
what I mean? Because there's so many people who just don't realize that it's not a thing. Like, it's never just a period. It's not just, oh, my periods are painful. It's just what it is. It's been like that forever. Or,
yeah,
oh, all of my family have had painful periods and it's just one of those things. Okay, maybe actually all
mm,
of you and your family have something,
yeah,
and it's something that can be managed if we manage it early. And what I always say, and I've heard this from someone, it was Lena Chan who said it the other day, but it's something I'm hearing a lot lately, and it is the approach. We all often take a reactive approach to things,
yeah,
reactive approach to our health. It's
yeah,
only when it happens, something bad happens, or we develop the condition, that we then act on it. Why do we not do or take a proactive approach
yeah,
before we get there? Learn about these things early on to prevent it from occurring, or at least get diagnosed early, where then the treatment is more likely to be curative, and also we're less likely to develop the complications that are associated with it. There's a lot.
there is a lot. No, it's true. I think, yeah, being more proactive in your health is important, because you're right. So many of us leave it too late, don't get the diagnosis, don't want to go to the doctors, or we go to the doctors and we're dismissed, and all of this is so much
Yeah.
in there. But being proactive about your health before it gets to that point, and that whole education piece, which is why, again, what you do, what we do, is so important. Let people be educated. You don't know what you don't know, so like, at least before you even go to that stage of diagnosis or whatever, you have some idea. Like, it's so important. Like, knowledge really is power, and I'm grateful for these kind of platforms. Like, is yeah, so interesting to have these conversations. I guess you brought up something that I wanted to ask that wasn't part of the questions actually, but how do you manage endo, full stop, and how would that be managed during pregnancy as well? Is there, like you said, there's a special pathway, but in general, how is it managed? Is it through drugs? Is it surgery? How does that work?
So I always like to say that when we're managing anything, we're looking at the patient in front of us and we're using a patient-centered approach, an individualized approach. We're going with what works best for the patient in their current situation. So endometriosis in someone who isn't planning to have a baby anytime soon, one of the first recommendations would be hormonal contraceptives, right? And that's because, remember, I said that this is an estrogen dependent um, condition. So when you're taking hormonal contraception, what we're doing is we're giving a low level that's constant. So it prevents that, the thickening of the endometrial tissue, which then has nowhere to shed, and it causes the scarring and inflammation. So we're trying to reduce that from happening. And that is often why we recommend the hormonal contraceptives. We also would give, there are other hormonal medications that we can also give to try and essentially induce menopause. It kind of puts you in menopause, so you're not having that fluctuation. So that's quite specialist. That would be the gynecologist that would recommend that, or did prescriptions for those sort of things. If I saw someone who had it, as well as recommending that, you want to make sure that you're giving them enough analgesic medication, so painkillers to help with the pain symptoms that they're going through, right? And then I guess what's most important is confirming the diagnosis. So once we've done the referral, when you see the specialist, sometimes we will have already done an ultrasound scan to see if there are any changes. Sometimes they could see cysts on the ovaries that could be quite visible on the ultrasound scan, but it's not always the case that you could see in that. And in fact, the gold standard diagnostic approach for endometriosis is laparoscopy. So that's where they do keyhole surgery to have a look to see if it's inside. And that in itself can help with the treatment, because once they see it, they can either do something called ablation, which is where they burn the endometrial tissue, but actually more and more specialists say the best thing to do to treat it is to remove the tissues completely. So they excise it, right? And then depending on where they find the tissue, like if the tissue is on the bowel and it's very severe, in very severe cases, they may need to remove part of the bowel. If it's on like the ureters, so the tube that carries urine from the kidney down to the bladder, they may need to remove certain aspects. People have had to have nephrostomies or even colonoscopies, colostomies. And this is where they're having bags on the outside of their abdomen because they need to redirect where the stool or the urine is going because of how severely damaged the endometrial tissues can get, and the damage that it causes to these vital organs. So that's like really extreme cases. So surgery, as I say, is another treatment option. I always like to talk about lifestyle because we sometimes forget about that.
I was like, are there any food or activities
Yeah.
you can do to kind of manage your symptoms, help you get,
Yeah, absolutely. So lifestyle.
Yeah, do you know what I mean?
I think what we forget is that, when we give medication, often it's like putting a band-aid, but what you want to do is also do the other activities that could potentially maintain things or at least stop things from progressing. So just what I always say about lifestyle in general, and this is for anything, make sure that you're eating healthily, have your fruits and vegetables. Those are anti-inflammatory foods. Make sure that you are drinking plenty of water, that you're exercising, that you're maintaining a healthy weight, that you're not smoking, and that this the jury is out on this one. Don't drink alcohol at all, or if you are going to drink alcohol, just really minimize it. So as I say, endometriosis is an inflammatory condition, so you want to try and avoid the foods that increase your inflammation. So these would be foods like red meat, right? Or processed food or fried foods, having dairy products. So some women find that if they have too much dairy, it can exacerbate their symptoms, again, because of the inflammatory potential, but as well as the hormonal component in the dairy products. And then some people who have a lot of gluten in their food, or who have a lot of soy products, so like your soy milk and your soy sauce, they have a lot of what's called phytoestrogens, which can mimic the estrogen in the body and then worsen the symptoms. Again, caffeine and alcohol, all of those are pro-inflammatory. So you want to reduce those to reduce the inflammatory process that's associated with endometriosis. But also you want to reduce any refined sugars or excessive carbohydrates, because we know that those can exacerbate inflammation. So instead you want to try and have more whole grain foods and natural sweeteners, have your fruits and vegetables, have your omega-3 and your fatty acid, your lean protein. So you want to have your white meat, chicken, turkey, have more of your plant-based proteins like your beans and your legumes, like your peanuts and so on. You want to have whole grain foods. You want to have fiber rich foods, and you want to listen to your body. So you don't want exercise is good, but you want to be careful not to do too much high impact exercises, because for some people that can actually aggravate their symptoms.
Right.
You want to try to reduce your stress, because we know that stress can increase the inflammatory process in the body. So whether it's meditation and yoga and deep breathing,
Pilates.
deep
Pilates
breathing
thing now.
exercises. Pilates, exactly. Try and avoid sitting down for too long. Make sure that you have breaks in between, not sitting down for too long, not standing for too long. All those things. Make sure that you're drinking enough water, right?
Very basic, so very simple.
Exactly. Get your water in, have your 2 liters. That again can help to flush out your system, sorry, and help to manage your symptoms. I feel like I've said so much.
No, all great stuff. No, honestly, in terms of managing symptoms and what you can do, I think overall that's just great advice, but definitely specifically for someone who may think that they have it and maybe are looking for things that they can do to help manage it themselves, especially if it takes so long to get a diagnosis. Are there other things that people can do in the meantime? So that's very helpful. Yeah, and I guess that brings me to the end of my questions, and that's been it. Honestly, I feel like I've had so many moments, like my mind's blown. So hopefully, whoever is watching this out there has also been very well blessed and educated by this. So thank you very much. Let everyone know where we can find you, and all your amazing health content. You're also on YouTube, aren't you? So like, I'm sure not even I'm sure, I know it's full of like amazing gems and just really great health information that you can benefit from no matter who you are. So yeah, please do share, and maybe one final thought before we go.
Okay, of course. Okay, before I share, my one final thought would be, please listen to your body, okay? Nobody knows your body better than you. And if you think that something is wrong and something isn't right, go and see a doctor. And if you feel like you're not being listened to or being dismissed, see another doctor. Seek a second, a third, or a fourth opinion. Just please don't give up. Please don't suffer in silence. And if you heard anything today that you think, this might be me, I encourage and I implore you to please go and get checked out, just in case. Okay? Know your body, understand your body, do your self checks, and get seen whenever you're concerned. Like that's all I always push for, because honestly, early detection saves lives, literally.
Yeah, amazing.
Oh, and then I'll get your screening done as well.
Always important.
But you can find me on all of the socials, actually, at Talks with Dr. Sesay. So that's YouTube, TikTok, Instagram, and I'm also on, I don't really use X, but Dr. Aziza Sesay, because everyone always asks me, and it's the only one that's different, but everywhere else is Talks with Dr. Sesay, and on my website, talkswithdrsesay.com. And if you want to email me, I'm on drsesay101@gmail.com.
Perfect. Thank you so much for today, and I'm sure we'll be seeing you very soon.
Yes, always here. Love you guys.
Thank
Bye.
you.